Great. Thank you so much, Sylvia, for the introduction, and thank you everyone for joining us today. Yes, the presentation is being recorded to answer your question. And yeah, so I wanted to give everyone a warm welcome to today's webinar on implementing Food Rx programs for health center settings. I'm so glad to see everyone sharing in the chat where you're joining from and your interest in this webinar. We'll try to answer any questions if they pertain to the content of the webinar that we're discussing at the moment, but do know that there will be time for questions at the end of the webinar. So not to worry, keep dropping those answers in the chat, keep sharing your interest. Yeah, really good to see people from all over the country and different areas of interest and levels of participation. And you can go to the next slide. If you've never heard of us, I wanted to give a little background on who we are at the National Center for Farmworker Health. We're a private nonprofit organization located in Buda, Texas, and our mission is to improve the health of farm worker families. We do this through population-specific data, resources and technical assistance, workforce development and training, health education, resources, and program development. We also do board governance training and program management. Next slide, please. During today's webinar, we're going to learn about food prescription program models that address the link between food insecurity and diet-related chronic disease. We'll hopefully familiarize you all with the Food Rx Replication Guide for health centers that we developed and demonstrate how to use it to create your very own personalized produce prescription program in partnership with your local organizations in your community. And we're going to identify steps to assess the implementation of a food prescription program. Next slide, please. So in order to facilitate the implementation of Food Rx programs in health center settings, we at the National Center for Farmworker Health have developed a Food Rx Replication Guide for health centers. We're very excited to be able to share the guide after extensive research, interviews, and meetings to compile all of the best resources and information for you all on this topic into one place. And we are sharing the Food Rx guide in the chat, so you'll be able to view it and look through it while we cover this presentation. Next slide. Now, just a quick note on naming. We'll use the terms Food Rx, food prescription, and produce prescription programs interchangeably throughout this presentation. Some of you may be more familiar with one of these terms, so I wanted to clarify that this guide can be used for any of the above named terms. And our purpose in creating the Food Rx Replication Guide was to address the needs seen by health centers across the country to reduce food insecurity in their patient populations, also to reduce the incidence of diet-related diseases, and reduce the cost of care that's associated with preventing and managing these conditions. So we designed this guide to be as user-friendly as possible to help you all implement your own Food Rx programs. So with that in mind, we created it to be comprehensive, step-by-step, and keeping in mind that health center staff often have limited time or resources at your disposal. I also wanted to clarify that while this guide is suitable for addressing food insecurity in farm worker populations, that's obviously our population that we focus on, it was designed for all patients of health centers in mind, who certainly include farm workers, but are not limited to them. Next slide. So what all does the guide cover? Inside, you'll find, sorry, I'm a little bit out of order. Okay. So the guide is applicable to nearly any health center looking to implement a Food Rx program, even if you don't have funding in place or have solidified partnerships to provide the actual produce. That's okay. You can still get started, read the guide, check it out. And another key takeaway from this guide is that we do think it will empower you to see food insecurity as the modifiable health risk that it is. And while it's not an area that traditionally falls within the scope of healthcare, it is a huge driver of many chronic conditions, and it's something we can change. We also wanted to highlight that a program like this benefits both the health center and the patient through improved health, decreased food insecurity, decreased cost, and improved patient and provider relationships. And while some of the science is still out on proving all of these things, we see a lot of preliminary evidence to show that these things are true. And we're building more and more of a case for this all the time. And so I think you'll all, in addition to some of the statistics and facts we've included here today, I think you'll see this body of work and research continue to grow over the coming years. Next slide. Sylvia, I wanted to see, could you just go back? We might have skipped a slide. There should be this one. Okay, great. Thanks. So I wanted to cover what all does the guide cover. Inside, you'll find an introduction linking food security and chronic disease with notes on special considerations for farm worker populations. Next, you'll find a health center readiness assessment, asset mapping activity, partner readiness assessment, keys to developing successful Food Rx partnerships, opportunities for additional funding, action planning checklists and background information, tips for implementing a successful program. And after the conclusion, you'll also find additional resources and references and the appendices where you'll find a lot of those assessment tools. Okay, you can go to the next slide. Next. Okay, so we can take it from here. So why should health centers care about addressing food insecurity? Health centers are moving more towards a value-based system of care. And one of the keys to understanding one of the keys to understanding why it's important to address food insecurity and chronic disease is health, right? So understanding that link is crucial. So we see connections between food insecurity, stress, and chronic disease incidence. A couple reasons for this is when folks have low access to healthy foods like fruits, vegetables, and healthy staples, it can be more difficult to manage chronic disease, right? We need folks to have access to those foods in order to manage their illnesses. Less expensive foods tend to be also less healthy. And so when folks are experiencing food insecurity, they also tend to experience lower nutritional quality. And then we also see stress associated with wondering where people's next meals will come from. Next slide. So why else should health centers care about addressing food insecurity? As we mentioned, the move towards value-based system of care, we see that health centers are looking to improve social drivers of health or social determinants of health, improve overall health, and keep costs down. And one of the aims of the program is just this, to keep costs down, right? This is something that the guide covers. And when we look at a systems-wide analysis of the costs associated with Food Rx programs, one study found that giving Medicare and Medicaid participants a 30% subsidy to reduce the cost of produce would result in a $39.7 billion savings in healthcare costs nationally over a lifetime. So while we see often that healthcare is addressing downstream effects of social drivers of poor health, this is an opportunity to address these issues further upstream and save the patients and the healthcare system a lot of money in the process. Next slide. So earlier this year, we did a very brief introductory webinar to the benefits of a Food Rx program. And as you'll see here, these were the many responses that folks shared when it came to their ideas of what are the benefits of a Food Rx program and things they've seen. So you'll see an increase in the selection of foods, nutrition education, healthier kids, less depression, health equity, mental clarity, better attitudes, better disease management. So the list of benefits goes on and on and on. Next slide. We do want to highlight some of the benefits that the health center and health system benefits and the improvements in health measures that we've seen through Food Rx programs. One of these is improved blood pressure, body mass index. We see a reduction in hemoglobin A1C levels in individuals with diabetes. Of course, we would hope to see a decrease, and we do see a decrease in food insecurity. And we also see a decrease in depressive symptoms and overall health management. Something else that is a little bit harder to measure, but we have seen qualitatively, is an improvement in patient-provider relationships. So that sense of trust between the patient and the health center. Next slide. So now let's look at how we can apply the Food Rx Replication Guide to reap all of these benefits that we've just mentioned. Next slide. The first step is to assess the readiness of your health center to see how prepared you are to implement a program. So here we included a readiness assessment with fillable checkboxes and totals so that you can self-assess your organization on some key foundational areas to ensure program success. So next slide. So, and Sylvia, you can go ahead and launch. Our first question here related to readiness assessments is, does your health center screen for food insecurity? And I'm curious, so how many of you are currently screening for food insecurity or other social determinants of health at your organization? We've seen this to be one of the key areas needed to begin to establish this type of program. And so I'm curious, how many of you all are already doing something like this? And Sylvia, I'm not able to see how many folks have participated, but you can give this poll just a minute or so, and then we'll end it. Okay, so I hope that all of you could also see the poll results, but just in case, I'd like to highlight, so 55% of you are already implementing a screening and collecting data on a range of social determinants of health. That's really good to hear. And that's definitely, where we see these screenings going. It looks like 23% implemented a screening and are collecting patient data on food insecurity. 14% are looking to implement food insecurity screenings, 5% none at this time, and For those of you who answered other, I would love to hear in the chat, was there some sort of challenge that you encountered that didn't allow you to begin screening for food insecurity or other social determinants of health? Or, maybe you don't have access to patients. Tell me about what's the reason for that other. Okay. So once you've determined that your organization is ready to implement a program, you'll need to identify partners in your community to supply produce and potentially provide education, coordination, or funding. So in the guide, we've included an asset mapping activity to conduct a scan of your local and regional community resources. And you'll want to identify as many organizations as possible in this scan so that you have options when you get to the next step, which we'll get to in just a little bit, which is actually assessing, are these organizations ready for this type of program, right? So some of them may not be ready. So identifying as many as possible that exist in your community can give you more options, but it's okay if you can only identify a few at first. And you can use this example asset map that we've created if you need ideas of where to look. In the guide, there is also a blank version of this asset map. So you're actually able to get together with your team at your health center and identify what are resources that you know of in your community. Let's fill them in. And I think the other thing that you'll see as you complete this activity is actually how many resources there are. Sometimes we feel like, oh, we don't have the funding, we don't have the resources, but don't be afraid to look outside of your health center and see what initiatives are already going on. There's probably a lot of expertise and a lot of synergy that can be created around these initiatives going on already. So neighborhood resources that, again, might not be directly inside of your health center, but we see a lot of health centers partnering with neighborhood resources, whether that be schools, community centers, nonprofits, transportation resources, right? Partnering with local transit authorities or with local even faith groups to provide transportation. Libraries, even we've seen a lot of folks conduct nutrition education out of libraries because it's an available community space. If, for example, you don't have a space in your health center to conduct the nutrition education that you'd like to do along with your Food Rx program. We also see a lot of states have a university extension program or a SNAP Ed program that's already providing some kind of nutrition education. Have you reached out to them to explore, could we partner with them to provide sort of preventative nutrition education to the folks who are enrolled in our program? You might even look out and find other health centers. Are there other health centers in your community that are already implementing a Food Rx program and you could scale with them? And perhaps most importantly, when we look around our community for produce sources, sometimes we have to be creative, especially when it comes to rural health centers. One of the things that we wanted to keep in mind is that when we think of food insecurity, when it comes to farm worker populations, many of these rural areas, right, all of this produce is being grown locally, but sometimes it's actually hard to access the produce that's grown there locally. So we wanted to really think outside of the box and not just rely on nonprofits who are specialized in distributing produce, but even if you don't have one of those local nonprofits, is there a food pantry? Is there a mobile market? Sometimes different colleges or companies will have on-site gardens or farms, and they're looking for a source for all this produce that they're growing. Is there a local farmer who's willing to set up a CSA, which stands for Community Supported Agriculture, a CSA type box distribution? Are there farmers markets? Some areas have food distributors who are for profit or not and are willing to become involved. And I just wanted to check in the chat. Oh, some folks are required to assess social determinants of health of each patient and are implementing a 5-question, sounds like survey on food insecurity. Okay, that's great to hear. I would love to hear what your 5-question screener is, because we're going to get to different food insecurity screenings in just a bit. So I'd love to hear more about that. And we can go to the next slide, I believe. So I'm curious, have you ever conducted a similar scan for resources to address social determinants of health? Go ahead and share in the chat. Have you conducted anything like an asset mapping activity in the past? And maybe for those of you who are aware of what sort of resources are available in your community, are you currently referring to any of the organizations that you found? So is anyone out there already referring to a food bank, or maybe an organization that assists with transportation, one that assists with childcare, right? Are there any resources that you're currently referring for related to social determinants of health? Okay, great. So Zenaida shared, we refer patients to the food bank and help with the applications for food stamps. So we've seen a couple of health centers expanding in that direction. And I'm curious, Zenaida, who on your team is involved in that process? That's actually something that you'll find on the health center readiness assessment is, are you currently referring and who's involved in that referral process? Because if you are currently referring and you have folks on your team involved, they probably care a bit about this issue, and they're a bit familiar with the landscape. So those could be some key folks to include on the planning of this or on the implementation of this Food Rx program. So George shared they're conducting a food pantry at 3 of your clinics. Amazing. I'd love to hear, how is that going? What sort of food is included? Are you finding any challenges? Linda shared, yes, we hand out food bank boxes here in the clinic. Amazing. Danielle shared, we have case managers. We're a federally qualified health center, so we actually do refer to food banks, transportation services, and are just starting out with the social determinants of health process. We all have to start somewhere, right? And a lot of times just starting to refer out is how we start to develop these connections and how a larger scale program could develop out of them. Oh, amazing. Donations from local farms and the state food bank. Okay. And Danielle said case managers, therapists, dietitians, and medical providers are all provided. So I'm so glad you shared that, Danielle. And I think that can give everyone here a sense of who can be involved on the team within the health center to make this program possible. Zenaida shared the provider refers patients also to the community health specialist to provide the community resources. Excellent. I'll give just a couple seconds to see if anyone else would like to share. Oh, wow. Okay. We have an internal food bank in the clinic that is supported through donations and a collection bin at the local supermarket. Patients are then connected with local food pantries or continue with ours if there is a challenge. Yes, I really like that, Wendy. And sometimes we see with certain programs that not all patients meet eligibility. And so it sounds like this local collection bin um, and then food being provided through the clinic could be a really good way to maybe address those patients who aren't eligible for other programs. And I also wanted to point out with Wendy's program that probably is a program that you could start out without very much additional funding at all. And that's something else that we wanted to facilitate through this guide, and that I mentioned at the beginning, is that not every health center is going to receive additional funding for these, but there are steps that you can take to start one of these programs even before you secure additional funding. Yeah, and Wendy said eligibility as well as hours for the pantries open are often barriers, especially when we see so many of our patients who have transportation issues or work late, have childcare issues. Those can absolutely be barriers. Thank you so much to everyone sharing in the chat. I really appreciate this. Okay. I'll continue to monitor the chat, and I have Sylvia and Maria here helping me out, but we can go to the next slide. So feel free to keep sharing. Okay. So at the base of any Food Rx or prescription produce program is the health center and usually some sort of produce partner. Usually the health center isn't able to do it all on their own. And the produce partner will vary, right? Sometimes it's a food bank, sometimes it's a farmer, sometimes it's a community coalition. So it can really vary, but the base of the program is usually going to be one or two organizations. You can add additional organizations for funding or for education, but right now we're going to look at that key partnership between the produce partner and the health center. And the type of produce partners available to you may determine what model your program follows. So again, this is very open-ended, very wide in scope. We wanted to make it available to health centers in urban areas, super rural areas, and everyone in between. So I wanted to give a brief overview of each program type and the types of partners needed to achieve them. So first, we'll start with voucher programs. So a voucher program is a partnership between a health center and a produce partner. And in this type of model, the health center is going to identify the patient who needs food assistance, provides a voucher or a coupon for a certain amount of produce, and then they refer them to the produce partner, right? That's the bare bones. There's lots more that we'll learn about, all the details of screenings and eligibility and enrollment processes, but this is the bare bones. So then once patients receive that referral and that voucher, their coupon, they can cash in their vouchers for fresh produce, and in some cases, other healthy food staples. That's why we use both the term Food Rx and produce prescription, because sometimes programs will include things like healthy whole grains, beans, nuts, etc. So some examples of the produce partners you might partner with to make this type of program a reality would be a farmer's market, a farm stand, a grocery store, or we've even seen this with native trading posts. So again, patients would receive basically a voucher, and they'd be able to cash that in at a farmer's market or grocery store, or any of these locations for produce or healthy food staples. And you can think of these programs as usually it's the patient going to the produce for the most part. This type of program has benefits that include freshness usually, and the availability or the option for the patient to choose. Those are two of the big benefits that we see with this program. Next slide. Next, we have food delivery programs. So this is a partnership between a health center and a produce partner, and this produce partner is going to be directly delivering the produce to an identified location. So in this program, the health center identifies the patient and refers them to the produce partner. The partner delivers produce to a residence, so it could be directly to the patient's home or to a centralized location, which could include the health center itself. And then the patients receive their produce or their healthy food staples at that specified location. And so we've seen this with food delivery programs where the food is delivered in a CSA box directly to the resident's home. We've also seen it with mobile markets or mobile pantries where the market or the pantry will pull up right outside of the health center, and the patients can have a kind of one-stop shop in terms of they go inside for their follow-up appointment, and then they can go right outside to the parking lot and pick up their box or their distribution. And so you can think of this one as the produce coming to the patient versus the last one we saw the patient coming to the produce. And some of the benefits of this type of program includes kind of getting around some of those transportation issues. So if you have a patient population who in general lacks a lot of transportation options, a food delivery program might be a good way of getting that produce to them rather than them having to go to the health center, to the farmer's market between these hours, and rather delivering it straight to a place that's convenient for them. We've also seen this with schools, right? So if patients are going to pick up their kids from school, school might be another place that's easy to pick up delivery. Next slide. And finally, we have referral programs. So this can be an excellent option for health centers with limited resources. And in this one, the health center identifies the patient, connects them to an already existing source of free produce, and integrates the referral process into their workflow to the greatest degree possible. So examples of partners that you would need to make this type of program work could be food pantries, Double Up SNAP, or the WIC cash value benefit programs. And so this can also be sort of your gateway from a simple, handing out flyers to patients, letting them know that these programs exist, to actually implementing the referral as part of your workflow and implementing follow-up and documentation as part of your workflow, because that documentation, the screening, the referral, the documentation, and the follow-up are going to be those pieces that you need to do a heavier lift with one of the two previous programs mentioned. And so if you're looking for additional funding, but you're not really in the place where you can be hiring additional staff to take on this program, a referral program can be a good sort of in-between to get you from just handing out flyers or letting patients know that the resources are there to actually connecting them with them and then scaling your own produce prescription program. Next slide. So I would love to know, now that you know a bit about each type of program, what produce sources are available in your area as potential partners? Go ahead, share in the chat. I know some folks already mentioned food pantries, and even food banks, grocery stores. But even if you're not currently partnering, go ahead and, share as many ideas as possible. What are some produce sources that you know of in your area that could be potential partners? Banks and farmers markets. Yeah. I'm curious, Danielle, do you mean food banks or is this actual like banks? I would love to hear about that. Kyla said local farms and community gardens. Yes. So we've seen that with, I forget the name. There's a program out in California who uses an all organic, all regenerative farm as their community partner. And we've seen that as a really great model because it both supports local farmers and also supports the community in addressing food insecurity. Community gardens can be another great one, especially if they're well organized. I used to volunteer with a community garden or a community farm rather that would donate literally hundreds, sometimes thousands of pounds of produce every week to their local food banks and food pantries. So this can be an excellent opportunity. Direct from farms. Yeah, another model that I've seen is gleaning programs. Some areas will have volunteer crews that go out to farms. This is an issue we see with farm labor actually, is sometimes farmers can't get farm labor to the farm quickly enough. And so it's devastatingly sad, but many times there are crops that are basically rotting in the fields. And so some areas actually have gleaning teams that will come through and pick produce to then donate it to local community organizations so that the produce doesn't go to waste. So it can be a great way to avoid food waste and reduce food insecurity. Churches can be another one. Yeah, I've definitely seen a lot of success with churches, community gardens, and food banks. Oh, wow. Expanding your program to include a community garden component, at least during the growing season in New England. Yes. Yes, Wendy. I'd love to hear where, well, I guess I could look back in the chat and see where you're joining from, but I love to hear about that. Danielle said that she's in Georgia, and we've also had Peach State Health Plan, Georgia Medicaid insurance to a mobile food bank to our clinics. Yeah, and when we get to funding in just a moment, we'll see that there's potentially going to be more Medicaid and Medicare options, hopefully. Central New Hampshire. Excellent. Well, thank you all for sharing. Again, feel free to continue sharing in the chat. And we can go to the next slide. Okay, so next we have assessing partner readiness. So once you've identified one or a few potential produce partners, you'll want to assess the readiness of this partner organization to initiate a Food Rx program. So not all organizations are going to be a suitable match for this type of endeavor, and the assessment will help to show you where the gaps are that need to be addressed before starting your program. And again, we just like a resource that you'll see in just a moment, we've differentiated these partner readiness assessments by program type because each program, whether it's voucher, food delivery, or referral, each program type will have different requirements and different things that organizations will need to be ready for. And so we tailored each of these readiness assessments to the type of program. And again, you can use, even if the answers are falling in the no category, meaning no, we're not quite ready to initiate a program. Sometimes this can be a great way of assessing where those gaps are and deciding where do we need to put our efforts before starting this program. So if, let's say, the organization is really excited to partner, but there's some no's, meaning no, they're not ready, or they've marked no on the readiness assessment, those, now you know, those are the areas that need to be addressed before starting the program. And once they are addressed, hopefully you'll have a really strong program. Next slide. So when you've identified your partners, you'll want to take a few key steps to develop a healthy partner relationship. So these steps include establishing clear roles and building trust and communication between partners. So we also included this program mapping activity for Food Rx programs, where we recommend that you actually map out how does both coordination and supervision work within the Food Rx program. And you can kind of use your existing organizational map and then map in, okay, who are the folks in our organization that need to be coordinating with who in the other organization. You can also use your program map to delineate roles. So actually filling in your program map who is responsible for what, so that going into the program, it's really clear where responsibilities fall for either organization and for the roles within each organization. And this can be especially important if you don't just have two partners, but you might have multiple partners, again, between the health center, the produce partner, educational organizations, funders. So it can get complicated when there's so many folks involved, but having a clear program map can definitely help with that. And then we also have some tips for building successful partner relationships, just things that we've heard from folks who are in the process of implementing these programs, and what they found along the way was helpful for them to have really good communication and dialogue, and most importantly, trust between partners. Next slide. So you'll likely want to explore additional funding as you scale your program. However, we wrote this guide so that even health centers with no funding in place can start their own program. And the Food Rx funding landscape is constantly changing. So I recommend checking back on some of these sites seasonally to find upcoming funding sources. I also just want to acknowledge we are not the absolute end all be all experts on funding sources for Food Rx programs. So I would also be really happy to hear from anyone here. Are there any funding sources that we missed? And please feel free to share. We would love to amplify those opportunities, whether it's ones you've heard of or even ones that you've used in the past. You can't use that funding anymore. So let's pass it along to others, pass that opportunity along to others so that hopefully they can get their program off the ground. So yeah, feel free to share in the chat. Are there any funding sources we missed? Next slide, please. So we included action planning checklists in the guide. Oh, okay. United Way Emergency Food Service Program. Yes, that's actually a great example, George. Thank you. So we included action planning checklists in the guide, which you'll see are broken down by the partner involved. And these action planning lists are also divided out by program type, just like the readiness assessments. So whether it's referral programs, delivery programs, or voucher programs, each program has an action planning list that is involved. And then a lot of the checklists in the action planning are key decision points that need to be made by the partnering organizations to determine the structure of your program. And we knew that, you know, not all organizations would be totally ready or comfortable making those decisions. So we included some key follow-up information, which I'll go over in some of the following slides. So one key decision point that's going to be need to be made in the development of your program and the planning for your program is choosing a screening tool. So we have 3 different options that we've outlined here. I'd be really curious to hear if there are any that we missed. And these kind of go from most extensive to most simple. So all the way on the left here, you'll see the prepare tool, which stands for protocol for responding and assessing patients' assets, risks, and experiences. This is a 21-question comprehensive social determinants of health screener. And this tool is certainly longer than a simple 2-question food insecurity screener that you'll see with the hunger vital sign. But it will give you a much more holistic view into patients' strengths and challenges, as well as present a clear story that's told through data. So this prepare tool is endorsed by the National Association for Community Health Centers, also known as NAC, and it's available in 25 languages, plus an adapted version for Native American populations. And it's already in use in a lot of health centers. So unless, for example, your funder is requiring that you change screener tools, we don't really see a reason for people to stop using the one they're using. So again, if you're already using this NAC prepare tool, you can absolutely use that to screen for food insecurity for your Food Rx program. Next, we have the USDA food security survey tools. And there's actually a variety of survey lengths that they offer to choose from, including a 6-item short form survey, a 10-question adult food security survey, and an 18-question U.S. household food security survey. And so there's advantages and limitations to each. Obviously, the shorter ones pose the least possible participant burden, but you know, it's less data, whereas the 18-question is many more questions, so better data for the most part, but also potentially a larger burden for participants and staff, especially if you have patients who are low literacy and you have staff that are reading the surveys to participants and completing them with them. An 18-question survey could obviously be a higher burden for staff as well. And just a note on language, the USDA food security survey tools are available in English, Spanish, and Chinese. So you wouldn't have to translate for those languages. And then finally, we have the hunger vital sign. It's a simple 2-question validated screener. This one is endorsed by the American Hospital Association, the American Academy of Pediatrics, and Feeding America. And it's a really simple 2-question screener that consists of, within the past 12 months, we worried whether our food would run out before we had money to buy more. And within the past 12 months, the food we bought just didn't last and we didn't have money to get more. And patients can respond with often true, sometimes true, or never true. And patients who answer either question with often true or sometimes true are considered to be food insecure. Okay, next slide. So you'll also need to choose eligibility criteria. A couple notes on choosing eligibility criteria. One is that the wider you go with your eligibility criteria, obviously the more patients you'll have that are eligible for your program. So it's important to consider what sort of funding do you have available, what sort of reach and scope are you reasonably able to accommodate with your program. So by being wider with your eligibility criteria and your scope, you can be more inclusive. However, you might not have the capacity for that. So maybe you choose a few key conditions that you need to focus on that are really prevalent in your patient population. So some of the more common diagnoses for eligibility that we see are diabetes or prediabetes, hypertension, or heart disease. But we've seen a wide variety of conditions that programs have chosen to determine as eligible. Some would include any metabolic disease. So, they're including PCOS, metabolic syndromes, fatty liver, prediabetes, obesity. Others are including some of the behavioral health issues that we see included with food insecurity, so depression or anxiety. And then we also see conditions like IBS being included, irritable bowel syndrome, asthma, COPD or emphysema, and HIV. Next slide, please. So with the patient experience, you want to ensure that your staff are well trained on screening, referral, enrollment, and follow-up so that you're providing a seamless experience for your patients. We also recommend developing some enrollment materials to facilitate the process. These could include baseline surveys and screenings, an overview of the program, distribution times or retail hours, instructions that they might need. And then, do you have any lifestyle or disease prevention programming? If so, you're going to want to let participants know of the places and times for those, if they're different from where they're picking up their food or receiving their food. And then the date and time of their next appointment at the health center, and also letting patients know, is this a 6-month program? Is it a year-long program? Letting them know so that they can set their expectations, and they're not going to be cut off without knowing that the end of their program is upcoming. Next slide. So I'll be brief with evaluation and tracking. What I'd like to say about this is that the better you document your program and the better you evaluate the program, oftentimes the better data and the better story you'll be able to tell, especially if you're looking to expand your program and you're looking for funding. So we've included a broad variety of evaluation measures that you might choose to use for your program, and where these might come from. We cannot recommend enough integrating your electronic health record or electronic medical record into both alerting the staff when patients are eligible to meet criteria, but also triggering workflows and documenting when patients follow up and redeem their food prescription. And we have resources in case your EHR does not offer those capabilities. Next slide. And finally, we have some notes on implementing your program. So after you've gone through all of these steps to thoroughly plan your program, when it comes to executing it, there's a few things that you'll want to keep in mind. One, again, is monitoring it to demonstrate the effectiveness of your program. And that's not just for funders, but that's also to give you all a sense of, are we having our intended consequence? Are we actually lowering food insecurity, reducing food insecurity? Are we actually improving disease measures? Are folks actually experiencing an improvement in the quality of their lives as a result of this program? So monitoring it, and then sharing out your successes and challenges. So getting in contact with the National Center for Farmworker Health or partners around the country, and both sharing and hearing from them what has been the struggle for you, and what have your successes been, and things you can share with others as best practices. And finally, continual improvement. So every quarter, we recommend that you reflect on how your program is proceeding, and it's an excellent time to review and organize the data that you've been collecting, meet with your program partners, you know, and just see, is the program a success? Are there things we need to work on? Maybe going back to your readiness assessment, are there still areas that we answered as sometimes we meet these criteria that you could move to always, so that the program is the best quality possible for your participants. Next slide. So I just want to go through really quick some additional resources. Obviously, you have a copy of the Food Rx Replication Guide. Please read through it. Let me know if you have questions or any sort of follow-up that you need with it. Next slide. And then we have some additional Food Rx resources. There's a produce prescription community of practice that meets every other month on the fourth Thursday from 1 to 2:30 p.m. This can be a great place to hear successes and challenges, and they have a lot of great speakers on a variety of topics related to produce prescription. So reach out to Ashley at MIFMA if you would like to join that group. And then we have some additional resources we will share in the follow-up email. Next slide. My contact information, again, all of this will be in the follow-up slides that you'll have. Next slide. And finally, I just wanted to thank you all. I know we're almost at time, but I wanted to leave space for questions if you have any questions. And thank you all so much for taking part in this. We're going to end the recording, but we will have time for question and answer. And please, we cannot stress enough how much it would help us to complete the evaluation for today's webinar. So for those of you joining via recording, thank you so much, and have a great day.